Are you getting SI pain or tension when you're working out? Don't stop working out. Instead, do this. Hey, I'm Dr. Jen Faboni, Doctor of Physical Therapy, better known as DocJenFit, and I want to give you some tools and exercises that you can do to keep moving. You don't have to stop moving at the first sign of pain and tension. It just might mean we need to switch things up a bit. Now, my first recommendation is to make sure you are breathing during exercise. This is crucial because it's going to help to take tension off of the back potentially, open up the hips better, open up the rib cage in the upper back, and it's going to help to create more stability within your trunk so that you feel a little bit more in control of the movement rather than too much excess movement potentially from that pelvis. Now, I have a video on core bracing if you want to understand how to use your breath under load a little bit better, so go check out that video. But real quick, one thing I just want to review is how when we're setting up for a deadlift or a squat, we're going to use that breath. So again, I want to make sure, first of all, I'm not hanging out forward into my hips before I even start an exercise. Unlock your knees. This is really going to help to put your body automatically in a better position. Okay. Take a big inhale and exhale. Now, when you inhale and exhale, what I want to make sure is that you're not going up or your belly isn't coming in on the inhale. That's actually called paradoxical breathing. And it's when we're actually doing backwards breathing. So when we take a breath in, we shouldn't just move from the belly, but we do want it to relax and we want this rib cage to expand. So place your hands on your rib cage, unlock your knees, take a deep breath into your hands. Belly relaxed, and then take a big, long, slow breath like you're blowing out a bunch of candles out through your mouth. Now, holding that contraction, take a breath into your hands again. It'll probably be a little bit smaller, and then exhale. This is where we're breathing from now. With a contracted position, I did a big inhale. I did a really long exhale to find that contraction from my rib cage over my pelvis. And then this is where I still breathe from. In and out from that rib cage. It's just with a tightened position into my entire core. That's what's really going to help to stabilize you as you're moving through movement and make sure that you keep breathing. So even as I do that really good core contraction, that brace, that doesn't mean that I'm not breathing with exercise. Maybe if you go super heavy loads, yes, we get to a point where we want to inhale and hold. However, if you're not there and you're just building up your strength, keep breathing. Inhale as you go down on the movement, exhale as you go up, and we're going to create that better stability and support as you're moving. Second, really important thing is that we're not overextending at the top of an exercise. And what I mean by that is when we're doing something like a deadlift, as you're coming down, inhaling around that rib cage and then exhaling as you come up, you're not pressing those hips forward to try to over-engage in your glutes. This is not your glute engagement. Your glute engagement actually comes from lengthening at the bottom and slowly pushing your feet down into the floor right to the top. That is where we get those glute gains. It is the length under load and the press down as you come up, but it's not the contraction at the top. So make sure you are not overextending in your exercise movements, or even with squats, you're not coming down and overextending to really try to feel those glutes engage. That is just going to put way more tension right into that SI area, which could be increasing the symptoms you're feeling. Lastly, I want to remind you that it is okay, especially during a period of pain, to reduce the load that you're lifting, maybe even doing body weight exercise, resistance bands, or also working on single leg stability. So maybe I'm going to reduce the weight to just one. And instead of doing 2 legs in a deadlift, I'm going to kickstand this back leg so I can really work on my single leg stability and support, pressing my hip back and then pressing down into the ground. Maybe I even shorten my range of motion because it doesn't feel good. Or maybe I'm using support from a pole as I come down and I come back up. There are always ways that we can modify the movement where we can slow it down, still feel the proper engagement, use less weight, work on single leg stability so that we help to improve our overall balance and strength, and we're not putting so much load and tension into your back. So you can try a kickstand deadlift, a regular single leg deadlift. Again, maybe using support at first as you go back into that movement. Maybe we're working on reverse lunges, Copenhagen planks, doing a side plank, but working on pressing that top leg into the ground or onto a higher surface. There are so many ways that we can start to engage in the single leg stability and build a really good core pressure, tension, and strength around those hips to support the SI rather than avoiding movement altogether. If this was helpful, if you want a little bit more specific exercises to help your SI, let me know down in the comments below. I also have some other videos that really can help for your SI. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.